The sacrum is a large bone or triangular bone which is located at the terminal part of the vertebral canal, where it forms the posterior aspect of the pelvis. It is remarkably thick, especially the upper part of the sacrum is massive because it supports the body weight and transmits it to the hip bones. The lower part is free from weight and therefore it tapers rapidly. So it aids in supporting and transmitting the weight of body. The sacrum is large flattened triangular bone. It is in the shape of an inverted triangle and it is formed by the fusion of five sacral vertebrae. So it is triangular in shape. It has a base, it has an apex, and it has four surfaces: pelvic, dorsal, and right and left lateral surface. The pelvic surface, it is smooth and concave. It is forming the posterior aspect of your bony pelvis. Then it consists of dorsal or posterior surface which is irregular and convex. And there is two lateral surface, that is right and left lateral surface. It is irregular and it is partially articular. So it is articulating on either side with the ilium, auricular surface of the ilium or the medial surface of the ilium, and take part in the formation of sacroiliac joint. Internally, you can see the central canal of the vertebral column is also continuing along with the core of the sacrum, and that is sacral canal, and ends at the fourth sacral foramina as the sacral hiatus. That opening is known as sacral hiatus at the end of the fourth sacral foramina. If you see this picture, you can see that the wide base and the narrow apex. And apex is going to articulate with the coccyx and form the sacrococcygeal joint. And the dorsal surface, it is irregular. You can see so many ridge-like area there. And so it is rough, it is irregular. And on either side, again, the irregular part of the bone, that is the lateral surface or auricular surface, and that part is going to articulate with your ilium. Sacrum is divided by rows of foramina into two regions. One is the median portion and a pair of lateral masses on either side of this median portion. And this median portion is transversed by sacral canal and a pair of lateral masses that is formed by the fusion of the transverse process posteriorly and costal elements anteriorly. So if you place the sacrum in anatomical position, the pelvic surface of the sacrum, that should face downward and forward, and the upper surface of the body of the first sacral vertebra, it slopes forward at an angle of 30°, and the upper end of the sacral canal is almost directed upward and backward. One is the pelvic surface of sacrum is facing downward forward, and the upper surface of body of the first sacral vertebra, that is the first one, base, it slopes forward and it forms an angle of about 30° forward at an angle of about 30 degree. And the upper end of the sacral canal is directed almost upward and backward. So this is the anatomical position of the sacrum. So we are going to the base of the sacrum. As you know now, the sacrum is inverted triangular shaped with the base above and narrow apex. And the base of the sacrum is broad and it is expanded and is directed upward and forward. So it is broad base is there. And you know that the sacrum is formed by the fusion of 5 sacral vertebrae. So the base of the sacrum, it is formed by the first sacral vertebra. And this sacral vertebra, first one, it is articulating with the vertebra above, that is L5. So lumbar vertebra, they are 5 in number. So it fused with the lumbar vertebra L5. And that joint is known as lumbosacral joint. Then, if you study all vertebrae, you study cervical, thoracic, and you know that for the vertebra, what are the features you can see is that there is a body, and followed by behind that there is a vertebral foramen, which is surrounded by the bony part, that is pedicle. There is a lamina, and at the junction you can see the superior inferior articular facets. Then the lamina fuse posteriorly and form, you can see the spine of the vertebra and can see the transverse process. These are the basic features of all vertebra, typical vertebra. So here what you can see is that the body of this base or the S1 is lumbar type, and its anterior margin is prominent or projecting, and that is known as the sacral promontory. So this sacral promontory is the broadened part and it marks the posterior border of your pelvic inlet, and it articulates at an angle or slopes forward. The sacral promontory slopes forward at an angle that is around 30 degree, and that is known as sacrovertebral angle. So you know that behind the body of vertebra there will be vertebral canal. So behind the first vertebra, S1 vertebra, the vertebral foramen is there, and that is continuous with the sacral canal, which is later formed by the fusion of the other sacral vertebra. So it is leading to the sacral canal. And the sacral canal is actually the continuation of the vertebral canal and run through the center for most of its parts. So like all vertebrae here also, we can see the body behind the vertebral foramen. It is bounded on either side by the pedicle, which is directed backward and laterally. Then the lamina is there, which is oblique. And there is a spine will be there that form the first spinous tubercle. So the spine of the first cervical vertebra, that is S1, that is the first spinous tubercle. You will identify the midline of the sacrum, that is behind the sacral, that is the vertebral foramina. The spine of first spinous tubercle you can see. And you also know that the superior articular facets are there, that is projecting upward. It is directed backward and medially. Then coming to the transverse process, it is highly modified. In the case of sacral vertebra, this transverse process, it is articulating with the costal element anteriorly, and it is forming the lateral mass of the sacrum. So, in the case of the upper part of this lateral mass or the base of the lateral mass, it is formed by the fusion of the transverse process of the first sacral vertebra with its corresponding costal element anteriorly, and it is forming the upper part of the lateral mass. So, the base of this lateral mass is actually seen, it is seen as a broad sloping surface, and it is spreading like a fan or fan wise spreading from the side of body, that is known as ala of sacrum. So once more, the lateral mass of sacrum, so you know that the sacrum can be divided into two parts. That is the median portion which contains the sacral canal, which is transversed by the sacral canal, and then lateral to the foramina. That portion is known as the lateral mass, which is formed by the fusion of the transverse process and the costal elements. So among this lateral mass, the base of the upper part, which is broad, and that is like a fan wise spreading, you can see. And so the base of lateral mass, which forms a broad sloping surface that is spreading like a fan from the side of body, that you will call it as ala of the sacrum. And the ala of sacrum is formed by the fusion of the transverse process and the corresponding costal element of the first sacral vertebra or the base of sacrum. So this ala, it is also forming the pelvic surface of ala is also taking part in the is also forming the boundary of your true pelvis. Okay, so or the pelvic brim, you can see that it is forming the boundary of your pelvis. So this ala again can be divided into a smooth medial part and a rough lateral part. The apex of the sacrum, it is formed by the inferior surface of the body of the fifth sacral vertebra. It bears an oval facet for the articulation with the coccyx and form the sacrococcygeal joint. The pelvic surface of the sacrum is less remarkable than the dorsal surface if you see it. And the surface is concave and is directed downward and forward. Superiorly on the pelvic surface, the body of first sacral vertebra, anterior margin of the body, that is known as sacral promontory. You can see that. And this sacral promontory, it forms the posterior margin of the pelvic inlet, and as a result it is seriously continuous with the margin of the ala of the sacrum, arcuate line of the ilium, then pecten pubis and the pubic crest of the bone, and how the pelvic inlet is formed. Coming to the median area of this pelvic surface, what you can see is marked by four transverse ridges. And this four transverse ridges, it indicates the line of fusion of the bodies of five sacral vertebrae. And these ridges on either side end at, and these ridges end on either side, you can see, at the four pelvic sacral foramina or anterior sacral foramina, and it communicates with the sacral canal through the intervertebral foramen. The bony bars between this foramina, it represent the costal elements. The bony bar that you see between these four foramina, that piece of bone, that represent the costal elements. And lateral to this foramina, these costal elements will unite with the transverse process and form the lateral mass of sacrum. You are seeing now the four sacral foramina or the pelvic sacral foramina or anterior sacral foramina. And the size of this foramina is decreased from above downward with a diminishing the size of the vertebral body. And what is the function of this foramina is that it provides an exit to the anterior division of sacral nerve and serve as an entrance to the lateral sacral arteries. So you know the lateral sacral arteries, there are two in number on each side. It is a branch of the posterior division of internal iliac artery. So this foramina serves as an entrance for this artery, and also this provide an exit for the sacral nerves, anterior division of sacral nerves. Then, so these four broad shallow grooves are present, which are separated by a prominent ridge lateral to the foramina. So lateral to the foramina, again you can see some shallow grooves which are separated by the ridge, and that is for the origin of piriformis muscle. So the anterior division of the sacral nerves, it passes through the grooves and ridges and also give origin to piriformis muscle. If you study the piriformis muscle in the lower limb or in the pelvis, it is a E-shaped origin. It is from the pelvic surface of the sacrum, middle three pieces of sacrum, from the pelvic surface of sacrum, the piriformis muscle will take E-shaped origin. So lateral to the groove, there is a presence of some shallow grooves are present lateral to foramina, and this ridges give origin to the piriformis muscle. So we have to understand that the sacrum have a pelvic surface, and what you can see in this pelvic surface is that one is the upper part sacral promontory, then followed by four ridges you can see that represent the fusion of five sacral vertebra, and at the end of these ridges you are identifying what? You are identifying the anterior sacral foramina or pelvic foramina, okay, which is for the passage of sacral nerves, anterior division of sacral nerves and lateral sacral arteries. Then the next thing you have to remember is that piriformis muscle, it took origin from this pelvic surface of the sacrum. These are the things we have to remember. In this picture, you can see the dorsal surface of the sacrum. So compared to the pelvic surface, you can see that in this, it is not that smooth or concave. Instead of that, it is rough and it is convex. So take the median aspect or the median plane of this bone. There you can see a crest in the midline. That is known as median sacral crest. And what is this median sacral crest? So that is formed by the fusion of the spine. Okay, so that is by the fusion of the spinous process of upper four sacral vertebrae. So it is forming the median crest. So it is represented on the top of that after the fusion. You can see the tubercles. So this crest is topped by 3 or 4 tubercles, which represents the fusion of the spinous process of upper 4 sacral vertebrae. Then below this below the fourth tubercle, you can see an inverted U-shaped gap in the posterior wall of the sacral canal. And this inverted U-shaped gap that you can see below the fourth tubercle in the median plane of the dorsum of the sacrum, that is known as sacral hiatus. So it is due to the failure of the fusion of the lamina of the fifth sacral vertebra. So it failed to fuse or it failed to meet posteriorly the lamina of the fifth sacral vertebra. So it produces a gap. A gap will be present in the median aspect of the dorsum, that is known as the sacral hiatus. So first, in line with the first spinous tubercle, there is a median crest. So that median crest is due to the fusion of the spinous process of upper 4 sacral vertebrae. So please clearly see the picture. What you can see in the midline, that is in line with the spinous process of the first sacral vertebra. The fusion is there. So that is forming the median sacral crest, and further lateral to the spine there will be lamina of the vertebra. So lateral to the median crest, the posterior surface of the sacrum, that is formed by the fusion of the laminae. Then further lateral to the lamina, what you can see is the articular process. So in line with the superior articular process of the first sacral vertebra, you can see there are 4 articular tubercle which represent the fusion of the articular process of the adjacent vertebrae. So, when coming to the inferior articular process of the fifth sacral vertebra, it is free. So, it is free and it forms the sacral cornua, which is projecting at the side of sacral hiatus. You already seen the sacral hiatus that is formed by the non-fusion of the lamina of the fifth sacral vertebra. There is a U-shaped gap. Hanging on either side of this U-shaped gap, what you can see is sacral cornua. What is the sacral cornua? It represents the inferior articular process of the fifth sacral vertebra. So, this is the thing you have to remember. The dorsum of the sacrum. Remember that there is a median sacral crest. That is by the fusion of the spinous process of the vertebra. Okay, so it is represented by spinous tubercles. Then further laterally, there is a fusion of the lamina. Then lateral to the lamina, there is a tubercles, that is by articular tubercle. So it represents the articular process of the sacral vertebra which is fusing together. But the inferior articular process, it is forming the sacral cornua, that is on the sides of the sacral hiatus, and sacral hiatus is seen on the midline due to the non-fusion of the lamina of the sacrum posteriorly. So, there will be another crest, that is intermediate sacral crest. So, that is formed by the fusion of this sacral articular process. Then, it should be noted that in this case, I already mentioned the superior articular process of your S1 vertebra, that is the first sacral vertebra, is not fused, and S5, that is also not fused. Inferior articular process of S5 is not fused. Superior articular process of the first sacral vertebra is also not fused. Therefore, the superior articular process of the first sacral vertebra, it is going to fuse with the vertebra above. That means the L5 vertebra. Similarly, the inferior articular process or the sacral cornua of L5, this sacral vertebra, that is articulating the sacral cornua, it is going to articulate with the coccygeal cornua, that is the superior articulating process of coccyx, and form the sacrococcygeal joint. So lateral to the articular tubercle, there are 4 dorsal sacral foraminae, or lateral to the intermediate crest, that is formed by the fusion of the articular process. Further lateral to that, what you can see is dorsal sacral foraminae. So they communicate with the sacral canal through the intervertebral foramina. So the structure that transmit by this foramina is that dorsal rami of the upper 4 sacral nerve. So you have to remember that on the pelvic surface you come across the 4 foramina. They are known as pelvic sacral foramina, and it transmits the ventral rami of upper four sacral nerves. The dorsal sacral foramina, it transmits the dorsal rami of the upper four sacral nerves. Lateral to this dorsal foramina, there is another crest, that is the lateral sacral crest, on which there are transverse tubercles. It representing the fused transverse process, and it gives attachment to the posterior sacroiliac ligaments and also sacrotuberous ligaments. The lateral surface is formed by the fusion of the transverse process and the costal elements of the sacral vertebra. It is wide above and narrow below. The upper wide part bears an L-shaped auricular surface anteriorly and a rough and deeply pitted area posteriorly. The auricular surface is formed by the fusion of costal elements, and it articulates with the auricular surface of ilium at the sacroiliac joint. The posterior roughened and pitted area that is formed by the transverse processes. You can see an abrupt medial bend at the lower end of the lateral surface. It is called the inferior lateral angle of the sacrum. Sacral canal, that is formed by the sacral vertebral foramina, and it is triangular in cross section and directed upward in anatomical position, but appears oblique at the upper end. Inferiorly, the sacral canal opens at the sacral hiatus. So laterally, it communicates through the intervertebral foramina, and then it communicates with the pelvic and dorsal sacral foramina. So there is a communication access through the intervertebral foramina. Then the contents of the sacral canal is spinal meninges, the phylum terminale, and the subdural and the subarachnoid spaces, which end at the level of S2. Therefore, the lower sacral nerves and the phylum terminale, it pierces the dura and arachnoid at the S2 level. And as you know, there is a sacral hiatus on the lower aspect, that is below the fourth tubercle, spinous tubercle, due to the non-fusion of the lamina of the fifth sacral vertebra. There is a space existing on the dorsum of the sacrum, that is the sacral hiatus. So there are some of the important structures emerging through this sacral hiatus. One is the fifth sacral nerve. It grew the lateral part of the fifth sacral vertebra. So structure emerging is fifth sacral nerve, and a pair of coccygeal nerves and the phylum terminale, which passes to the coccyx. So these are the structures emerging through the sacral hiatus, that is the fifth sacral nerve, a pair of coccygeal nerve, and the phylum terminale. Another important thing you have to remember regarding the relations of the sacrum, one is the pelvic surface of the ala. So from lateral to medial, you can remember the term mnemonic oils, lateral to medial. O stands for obturator nerve. Then the next is iliolumbar artery, and then medial to that is lumbosacral trunk, and most medial structure, that is on either side of the vertebral column, as you know, is the sympathetic chain. So lateral to medial oils, that is obturator nerve, iliolumbar artery, lumbosacral trunk, and sympathetic chain. Dealing with sexual dimorphism in the case of sacrum, if you take the sacral index, and that is calculated by taking the relationship of length and breadth into 100, that is the sacral index. If you say that the male sacrum is longer and narrower than in the case of female, so the average sacral index in the case of male is 105 and about 115 in the case of female. So the male sacrum, that is long and it is narrower. When you come to the concavity, that is the concavity of the ventral aspect or the pelvic aspect of the sacrum is uniform and it is shallow in the case of male. But if you come across the female, this concavity of the pelvic surface is irregular and this concavity is more marked between S1 and S2 and S3 and S4. So the concavity is irregular. Then coming to the width of the S1 vertebra or the first sacral vertebra, you can notice that the width of the body of the first sacral vertebra is greater in the case of male compared to the size of ala. The vertebra is larger. It is wider than the ala of the sacrum. In the female, both the ala and the sacrum almost of equal size. Then the other one is regarding the sacrovertebral angle. That angle is more prominent in the case of female and the downward direction of the pelvis is also greater in female. So the size of pelvic cavity is more in female. And one more point that regarding the sacral promontory, it is also more prominent in the case of male. So that the cavity, the pelvic cavity or the pelvic inlet of the male is heart shaped. When you come to the function of sacrum, we can see that there are several key muscles of the hip joint that is attached to the sacrum. That is the gluteus maximus. You will study along with the lower limb, the chief extensor of the hip joint that help us to getting up from the sitting position, and anti-gravity muscle. Then from the iliac fossa, that you can see the iliacus, that is also originating from the sacrum, and the piriformis. It has an origin from the pelvic surface of the sacrum. So they pull on the sacrum to move the leg. And the sacrum also surrounds and protects the spinal nerves of the lower back as they wind their way inferiorly toward the end of the trunk and into the length. So they are protecting the spinal nerves. And finally the sacrum helps to form the posterior boundary of the pelvic cavity, and it supports and protects the delicate organs of the abdominal pelvic cavity, and it also provides space for a fetus to pass through during the childbirth. So these are some of the important functions of the sacrum. The clinical aspects, spina bifida. It occurs as a result of the defective embryonic neural neurotube. It is a neural tube defect. As you already studied the neural tube and its closure, anterior neuropore and posterior neuropore. Spina bifida, it is the defective neural tube development. So there is incomplete closure of the vertebral arch or incomplete closure of the surface of the vertebral canal. And it is most common in the lumbar and sacral area. So it is called spina bifida. And sacral agenesis is characterized by an abnormal of the lower spine, which may result in complete or incomplete absence of sacrum and lower spines. So that is sacral agenesis, where there is in complete absence of sacrum, complete or incomplete absence, and the lower spine, abnormal lower spine will be there. And the sacrum is one of the main sites for the development of malignancies like chondromas and sarcoma. Thank you.